want us to discuss about the recent outbreak of the Hantavirus, which recently broke out in a cruise ship. So today we are going to discuss the hantavirus. So hantaviruses are a group of viruses carried by rodents that can cause severe disease in humans. So people usually get infected through contact with infected rodents or their urine, droppings, or saliva. So infection with hantaviruses can cause a range of illnesses, which include severe disease and death. So in the Americas, hantaviruses can cause hantavirus cardiopulmonary syndrome, a severe respiratory illness with a case fatality rate of up to 50%. So the Aedes virus, which is found in South Africa, is a currently known hantavirus for which limited human-to-human transmission among contacts has been documented. So in Europe and Asia, hantaviruses cause hemorrhagic fever with renal syndrome. Okay, so let's talk about the antivirus deeply. So this one is a recap or a review uh, taken from the W Health Organization, uh, published on the 6th of May 2026. So hantaviruses are zoonotic viruses that naturally infect rodents and are occasionally transmitted to humans. So infection in people, as we've said, can cause severe illness and lead to death. Although this disease usually vary by type of virus and geographical location. So in the Americas, like we've said, the infection has been known to lead to hantavirus cardiopulmonary syndrome, a rapid progressive condition affecting the lungs and heart, while in Europe and Asia, hantaviruses have been known to cause hemorrhagic fever with renal syndrome, which primarily affects the kidneys and blood vessels. So, while there is no specific treatment that cures hantavirus disease, early supportive medical care is key to improve survival and focuses on close clinical monitoring and management of respiratory, cardiac, and kidney complications. So, prevention deeply or depends largely on reducing contact between people and infected rodents. So, what is the viral family and classification? So, hantaviruses belong to the family Hantaviridae within the order Barnaviridae. Each hantavirus is typically associated with a specific rodent reservoir species in which the virus causes long-term infection without apparent illness. Although many hantavirus species have been identified worldwide, only a limited number are known to cause the human disease. So we have hantavirus present in, for example, North, Central, and South America. Like we've said, they cause the HCPs. So the Aedes virus is part of this family and is known to cause limited human-to-human transmission among close and prolonged contacts, primarily in Argentina and Chile. So antiviruses in Europe and Asia are known to cause hemorrhagic fever with HFRS. So we have human to human transmission has not been documented in Asia and Europe. So what is the burden of this disease? So antivirus infections are relatively uncommon globally and are associated with a case fatality rate of less than 1 to 15% in Asia and Europe, and up to 50% in the Americas. So, worldwide, it is estimated that from 10,000 to over 100,000 infections occur each year, with the largest burden in Asia and Europe. So, with these, we ask ourselves, what happens in Asia, in Korea, in China, and other countries and other parts of the world. What type of burden does this disease cause in other places? So in East Asia, particularly China and Republic of Korea, HFRS continues to account for many thousands of cases annually, although incidents have declined in the recent decades. So in Europe, several thousand cases are reported each year, mainly northern and central regions where pulmonary virus circulates. So in the Americas, HCPS is much rarer, with hundreds of cases reported each year across the continent. So the United States of America has reported fewer than 1,000 cases, while South African countries like Argentina, Brazil, Chile, and Paraguay report small numbers of cases annually. So how is this hantavirus transmitted? So transmission of hantavirus to humans occur from contact with contaminated urine, droppings, or saliva of infected rodents. Infection may also occur, although less commonly, through rodent bites. So we are going to have activities that involve contact with rodents, such as maybe cleaning enclosed or poorly ventilated spaces, farming, forestry work, and sleeping in rodent-infested dwellings increase exposure risk of the hantavirus disease. So up to date, human-to-human transmission has been documented only for the Aedes virus in the Americas and remains uncommon. So when it occurs, transmission between people has been associated with close and prolonged contact. So particularly among household members or intimate partners, and appears most likely during the early phases of illness when the virus is more transmittable. Okay, so symptoms and clinical presentation. So in humans, symptoms usually begin between 1 and 8 weeks after exposure, depending on the type of virus, and typically it is going to include headache, fever, muscle aches, and gastrointestinal symptoms such as abdominal pain, nausea, or vomiting. So in HCPS, the disease may progress rapidly through cough, shortness of breath, accumulation of fluid in the lungs, and shock. So in HFRS, later stages may include low blood pressure, bleeding disorders, and kidney failure. So what is the diagnosis of the hantavirus? How do we diagnose that you have hantavirus? So, early diagnosis of hantavirus infection can be very challenging because early symptoms are common with other febrile or respiratory illnesses such as the influenza, COVID-19, viral pneumonia, or sepsis. So, a careful patient history is therefore essential, with particular attention to possible rodent exposure, occupational and environmental risks, travel history, and contact with known cases in areas where antiviruses are present. So, laboratory confirmation relies on serological testing to detect hantavirus specific IgM antibodies or rising IgG titers, as well as molecular methods such as reverse transcription, polymerase chain reaction during the acute phase of illness when viral RNA may be detected in blood. So samples collected from patients are a biohazard risk. So laboratory testing on non-inactivated samples should be conducted under maximum biological containment conditions. So treatment. So there is no licensed specific antiviral treatment or vaccine for hantavirus infection. So care is supportive and focuses on close clinical monitoring and management of respiratory, cardiac, and kidney complications. So early access to intensive care when clinically indicated improves outcomes, particularly for patients with hantavirus cardiopulmonary syndrome. What is the prevention and control of hantavirus? So, preventing hantavirus infection depends primarily on reducing contact between people and rodents. So, effective measures include keeping homes and workplaces clean, sealing openings that allow rodents to enter buildings, storing food securely, using safe cleaning practices in areas contaminated by rodents, avoiding dry sweeping or vacuuming rodent droppings, dampening of contaminated areas before cleaning, and strengthening hand hygiene practices. So, with this overview of the hantavirus from the WHO, we can see that hantavirus is mostly transmitted by rodents, contact with rodents. So with this, I would like to say thank you and see you in other videos.